7 deaths and 806 new COVID-19 infections were recorded on the island in the past 24 hours, bringing the total number of deaths to 492 and the total number of confirmed cases to 31,305 as of yesterday, March 14. Deputy Prime Minister and Minister of National Security Dr. Horace Chang encourages the public to get vaccinated when it becomes available to them.
I want to take the opportunity to encourage everyone to take the vaccine. Do not listen to the fake news, all kind of propaganda and other activity that discourages them.
Local Government and Rural Development Minister announces adjustment to island-wide ban on burials. And congratulations pour in for reggae legend Toots Hibbert posthumous victory at the Grammy Awards, which was announced yesterday.
Good evening. 7 deaths and 806 new COVID-19 infections were recorded on the island in the past 24 hours, bringing the total number of deaths to 492 and the total number of confirmed cases to 31,305. Statistics for yesterday from the Ministry of Health and Wellness indicate that 440 of the new cases were females and 366 males, with ages ranging from 42 days to 98 years old. The ministry report also showed that St. Catherine had the highest number of cases with 205 infections, followed by Kingston and St. Andrew with 150. St. James had 73 cases, Clarendon 70, St. Elizabeth 69 and St. Anne 64. There were 40 cases in Manchester, 34 in Portland, 27 in Trelawney and Hanover each, 26 in St. Thomas, 16 in St. Mary and 5 in Westmoreland. Additionally, 366 COVID-19 patients are in hospital, 35 considered critically ill and 32 moderately ill. Recoveries for the period are 114 with a total of 15,253, while 15,325 active cases remain. State Minister in the Ministry of Health and Wellness, Juliet Cuthbert-Flynn, has tested positive for COVID-19. The State Minister made the disclosure on Twitter this morning, noting that her duties as Member of Parliament for St. Andrew West Rural have been hampered. She tweeted saying, quote, "Having COVID-19 and being a representative of the people has been a challenge. I'm unable to visit my projects happening now, and I've asked my councillors to assist at this time," end quote. Cuthbert-Flynn urged the councillors and other parliamentarians to keep safe and encouraged Jamaicans to try and continue to do our best to keep each other safe. The State Minister also said that she received care at the Spanish Town Hospital and is doing well. The Hanover Health Department is encouraging the public to take precautions as the current surge in COVID-19 cases in the parish is expected to continue through the next month. Medical Officer of Health for Hanover, Dr. Kushal Singh, says the parish is expected to see a continued increase in cases.
Our hospital is fully occupied. We are using our surge capacity beds. So if you look at by then we are almost 160% any point of time occupancy. Means that what is our capacity is more than 1/2/3 of that we are operating at this time. Hope is that the vaccine is here. We started vaccinating our healthcare workers. Yesterday, I think Western region did wonderful. We went almost 100, the target we were given, we surpassed by 52%. For us also, our target was for the day is 90, but we vaccinated 93. So vaccination started. Every day we are doing it, and it is targeted to healthcare workers, frontline workers, elderly in our community. Numbers has been circulated to make an appointment. I think it's in a mobile group. And we are going to do it. First, we are going to do it between Noel Home Hospital site and the Lucy Health Center site. Next week onward, we are going to open another site at Sandy Bay. In the beginning, we try to observe how things are going, and it is quite encouraging. People are coming forward and getting vaccine. There is no adverse effect noted from the yesterday's cohort, particularly in Hanover. I'm not talking about other places. So that is the positive part of it.
Dr. Singh further explained about the hospital occupancy rate of COVID-19 patients and the parish vaccination program.
If you look at your number, if you have this population, more than 25,000 population is positive, country-wise, then you can think of that. Basically, you are talking about more than 1.25% population. That is quite high number of confirmed cases. So it is the worst phase of our pandemic, and if I am looking at the data in Hanover, I'm not very sure that next 2 or 3 weeks it is going to improve. Because when we say decline only say if continuously 2 incubation period, means that 28 days we saw decreased number of cases, but that's not happening. So I can say next 4 weeks we are going to have more increase rather than decreasing, because trend is still up, trend is not going down.
Meanwhile, Medical Officer of Health for Westmoreland, Dr. Marcia Graham, says that the parish's public health department will have mobile COVID-19 vaccination teams to facilitate ease of access to the vaccine. Dr. Graham was addressing the monthly meeting of the Westmoreland Municipal Corporation in Savannah-Lamar, pointing out that the mobile teams will be serving those who are incarcerated, those who are in nursing homes, and those who are in infirmaries. For his part, Mayor of Savannah-Lamar, Councillor Bertel Moore, encouraged residents, especially those persons over 60, to ensure that they get vaccinated. As inoculation of the COVID-19 vaccine continues this week, Deputy Prime Minister and Minister of National Security, Dr. Horace Chang, is encouraging the public to get vaccinated when it becomes available to them. He was speaking after receiving his COVID-19 vaccine at the Type 5 clinic in Montego Bay earlier today.
This morning was very easy, very positive. The public health team was here, and I want to commend the entire public health team present and across the island, but in particular in St. James, who have set up an operation to provide vaccines for the white population, but starting with the frontline workers in the public health service, security services, and starting today, public officials and leaders of the country, and as they spread it out to the wider community as the vaccine becomes available. I want to take the opportunity to encourage everyone to take the vaccine. Do not listen to the fake news, all kind of propaganda and other activity that discourages them. And I think Jamaicans can speak to their public health officials, and I think we need to, in fact, we need to put them out there some more. They have been giving vaccines for many years. They are the backbone of the primary care service. Look forward to getting the vaccine to all our population, but in particular to the high-risk group, the over 60s, because today you really appreciate that the government took a decision that leadership should await the second round, and in fact, not all the leadership is doing vaccine this week. It's the cabinet members and parliamentarians 60 and over. The Prime Minister is holding for the next round, which may be next week. So I'm here not only as deputy, but I'm over 60. And my wife came in this morning, so they can assure the country we consider the vaccine safe and necessary.
Dr. Chang, in outlining the importance of the assistance of the security forces with the COVID-19 vaccination program, says vaccinating the population in a short period of time is a major logistic operation that requires the help of everyone.
Significant impact. The police, the last time I checked, we had well over 200 positive active cases. They've been going around. They're part of the population. The police in particular work within the communities. And once you get the community spread, police officers are going to be affected. The army has had a few, but not as extensive at this point. But bear in mind, the army also is on the road supporting the police. But we need them to be available to assist in managing the process as we go national in terms of not only public order, but they assist significantly in the logistics. Vaccination the nation in a short time is a major logistic operation. And the army is, of course, one of the best institutions at this kind of thing. So they're giving the public health officers their full support. So it's a whole of government, whole of nation approach to deal with this vaccine program. I think the whole country have to appreciate that. A major program for the nation that needs everybody on board.
He also gave an update on oxygen tanks being sourced to address the shortages in hospitals across the country.
I spoke to the head of IGL, that's the gas company that produced the oxygen. They had a challenge and in terms of having cylinders. The factory is producing, and therefore they could provide the hospitals for the pipe supply of oxygen, but they had shorter cylinders, which were delayed because of COVID. They have ordered from early last year when they heard the disease was spreading, and they ordered to get delayed, but they got us supply just yesterday, they cleared. So this week we should see a relief on the significant relief, and the rest of their cylinders are coming in, should be in 3 weeks' time. I was told that by the manager this morning. So they did get us supplying over the weekend, which they were allowed to clear it immediately. So they should have cylinders coming out this week to the hospitals. It is a major problem. They have not had this demand on cylinders for a long time, but the company is functioning well. They are working smoothly, just the shorter cylinders. And it had to do with shipment disruption coming from the Far East because of COVID-19.
In the meantime, the Jamaica Defense Force says members have the option to make a declaration on whether they will take the COVID-19 vaccine instead of a requirement to indemnify the Army. This statement by the JDF came following a previous statement that service members who do not take the vaccine would have to waive liability to the Army. In a release on Sunday, the JDF said, notwithstanding the example set by the Chief of Defense of Staff, no member of the force is ordered to take the vaccine. Members were reminded that in a recent address to soldiers by the Chief of Defense Staff, CDS Lieutenant General Rocky Meade, he had stated that, quote, by taking the vaccine, we are protecting others by first protecting ourselves. This is what we can do on a daily basis as men and women of the JDF, end quote. It said, however, since members who choose not to take the vaccine will need to indemnify the JDF from all responsibility which directly results from their failure to be inoculated. The JDF has also indicated that since the rollout of the government vaccine program last Wednesday, a total of 1,500 service members have been vaccinated. The force has also dismissed rumors that hundreds of soldiers have fallen ill after receiving the vaccine. The opposition People's National Party (PNP) says they disagree with the approach recently announced by the Ministry of Health and Wellness that soldiers of the Jamaica Defense Force (JDF) will be prioritized for vaccination ahead of elderly persons over the next few weeks. In a statement released on the weekend, the PNP said that previously it was announced that 10,000 JDF personnel had been included in the Phase 1 group totaling 247,789, but no indication had been given of the intragroup prioritization. There were also 174,987 elderly persons included in Phase 1 group. The Shadow Minister of Health, Dr. Maurice Guy, also stated that, quote, "This approach is not in keeping with the recommendations of the World Health Organization (WHO) SAGE roadmap for prioritizing uses of COVID-19 vaccines in the context of limited supply," end quote. The statement went on to say that almost by definition, the JDF is comprised of persons who are fit and healthy. The vast majority are under 40, and both officers and enlisted personnel retire by their mid-50s at the latest. They take regular health and fitness tests and also have good health services reserved for them. The statement says elderly persons living in congregant facilities should be a top priority. Dr. Guy also outlined that public health authorities such as the WHO and the CDC have determined that the risk of hospitalization and death from COVID is 10 to 20 times greater for elderly persons than it is for persons in the median age of a JDF soldier. Therefore, he says the approach to prioritize healthy soldiers over the elderly is unethical. The opposition said that they are calling on the Minister of Health to reverse this decision and pursue an approach which prioritizes those at the highest risk by virtue of age and comorbidities, as well as healthcare workers who are the first responders in this pandemic. He says the minister must give an account for this decision, which flies in the face of the established guidelines for fair, just, and ethical vaccine distribution in this pandemic. Minister of Local Government and Rural Development Desmond McKenzie has announced an adjustment to the 2-week ban on burials currently in force to allow for the disposal of human remains in specifically prescribed circumstances. A statement from the minister explained that having met with funeral directors and related stakeholders last week, a number of proposals emerged from those conversations. Accordingly, approval has been given for 1. The burial or cremation of bodies that are in an advanced state of decomposition. 2. The burial or cremation of bodies that are not in an advanced state of decomposition but have been recommended for immediate burial by the appropriate health authorities. And 3. The burial or cremation of indigent persons who die in state care. The statement outlined that these measures took effect on Saturday, March 13. The minister said that he wants to make it clear that only the clergy will be allowed to administer the final rites for persons who are buried or cremated in these 3 circumstances. No family gathering will be allowed, and that the current order prohibiting burials remain in effect. The minister also stated that approval has been given to allow families to obtain death certificates for submission to the Registrar General's Department to facilitate preparations for burials once the ban is lifted. He said what this means is that effective Monday, March 15, the Registrar General's Department will issue burial orders after receiving death certificates, so that families and funeral homes can make all the necessary arrangements for the final send-off of the deceased once the ban on burials is lifted. Minister McKenzie further explained that no burials are being authorized by this change. As an additional measure to ensure compliance with the ban on burials, he also wants to make it very clear that the municipal corporations will not be issuing interment orders without which no final disposal of a body can be done. Minister McKenzie also indicated that the government is considering additional proposals made by the stakeholders in the afterlife industry and commended them for their understanding, strong sense of partnership and cooperation with the administration as it continues to implement the necessary strategies to preserve and promote public health. In other news, Deputy Prime Minister and Minister of National Security, Dr. Horace Chang, earlier today outlined the plans to continue work on the Montego Bay bypass.
We've started the process in the last 3 years, fortunately, and much of the work is being done. You know, a highway is not, the work on a highway is not just putting tractor on the ground. The design work is being done. The acquisition of property is being done. The people around Montego Bay, we have acquired several property in the Portobello area. That continues. And we expect by the end of this year, you'll be in a position to go forward with the various, with actual shoveling in the ground, so to speak. But the money this year is to complete design work, acquisition work, and things like the environmental study that is required. Right? But that's progressing satisfactorily. It's a challenge in terms of traffic in Montego Bay, but we have to do it right.
In the meantime, the Deputy Prime Minister says while the government is awaiting a decision on the re-implementation of the states of emergency, they are making the necessary redeployment into areas to curtail the crime and violence.
Everything now depends on the lawyers. The AG has filed, and we'll have to get a date for the trial. And we don't want to move until we get that court ruling. So we await that. In the meantime, we make some necessary redeployment and strategic changes. And we have had gains. You saw what happened in Augustown with a number of other cases we have been able to deal with. And if you examine what's happening, you will see that the corporate area in the last 6 weeks have been very stable. So too had some activity in Clarendon, but less than last year. But small areas are popping out all over, and we just have to get more numbers out there. We are working on that, and so we have acquired Tranquility Bay, as I said before, and we have been refurbished Harman Barracks. So the facility to train more policemen has been established, and we are proceeding to recruit.
A joint police and military operation in Westmoreland led to a major drug seizure and the arrest of several men on Saturday. Members of the Narcotics Division, the St. James Operation Support Unit, and the military conducted a pre-dawn raid at Kettle District, Springfield in Westmoreland. During the operation on March 13, several premises and a motor car were searched. 2 9mm pistols and 35 9mm cartridges and approximately 600 pounds of cured ganja were seized. About 500 ganja plants and an acre of an illegal ganja were also destroyed. The estimated value of the 600 pounds of ganja is Jamaican $2.4 million. 5 persons were taken into custody in relation to the seizures. Their identities are being withheld pending further investigations. In other news, 36-year-old Ricardo Strawn, otherwise called Scooby, of Plantation Heights, St. James, was charged with the November 2020 murder of 26-year-old O'Shane Dobson. Reports from the Cambridge police are that on Tuesday, November 10, Dobson was sitting on a wall along the roadway when he was approached by Strawn. An argument reportedly ensued between both men, and Strawn allegedly pulled a firearm and opened gunfire, hitting him several times. Dobson was taken to the hospital where he was pronounced dead. On Friday, March 5, 2021, Strawn was arrested by the police during an operation carried out in the Cambridge area. On Thursday, March 11, an interview was conducted and he was subsequently charged. His court date is being finalized. And those are some of the stories making news. We will return with other stories as congratulations have been pouring in for reggae legend Toots Hibbert's posthumous victory at the Grammy Awards, which was announced yesterday. But first, let's take a break and then we'll join Christopher Scott with sports.